The first sound of the morning at Fort Kingsley Military Medical Center is not the helicopters outside or the distant roll of carts in the halls. It is the soft, steady beep from a monitor in Operating Room 3. Dr. Maya Thompson stands at the head of the table, gloved hands held in front of her chest, eyes fixed on the draped body of a soldier, barely out of his teens. The air smells of antiseptic and warmed plastic. Overhead lights bleach every color out of the room except the deep red beneath the open skin. Blood pressure, she asks. 120/74, the anesthesiologist replies, holding. The nurse to her right, Jenna, swallows hard. He looks so young. Maya does not answer. She has already seen the CT scan already traced the thin crescent of darkness along the edge of his brain. A small subdural hematoma, the report had said. Some argued it could wait. Observe for 12 hours. Repeat imaging in the morning. Maya had looked at the boy in the emergency bay. Dirt on his boots. A faded tattoo of a hawk on his forearm. She had watched his pupils react. Not slow, not fast, something in between, enough to make her skin tighten at the back of her neck. Now in the bright chill of the operating room, she feels it again. Scalpel, she says. The metal touches her palm. It fits as if it has always belonged there. She makes the first incision along the shaved line of his skull. There is a murmur from the doorway where a senior attending, Dr. Lambert, has his arms folded over his chest. I would have watched him overnight, he tells the circulating nurse in a low voice that is not quite low enough. But she was insistent. New people like to prove a point. Maya hears it. She keeps her eyes on the field. Dr. Lambert, she says quietly, if you are staying, please keep conversation to a minimum. He huffs through his nose but does not respond. The nurse beside her glances up for just a second, then returns to the task of suctioning the thin line of blood. The craniotomy whirs as Maya opens a small window in bone. Her hands move with economy. No wasted motion, no show. The suction clears. The brain swells slightly into the opening, pale and glistening under the surgical light. There it is, she murmurs. A dark, thin pool of blood lies along the surface. Not massive, but under the wrong circumstances, it could grow press crush. She has seen this happen in tents lit by failing generators with dust falling from the ceiling and mortar rounds landing close enough to shake the instruments on the tray. Evacuating the clot, she says. Her voice is calm, almost detached. She inserts the catheter, draws the old blood away in slow, deliberate movements. The monitor beeps on steady and regular, like the tick of a metronome. Intracranial pressure, she asks. Coming down, the anesthesiologist replies. Numbers look better. Beside her, Jenna lets out the breath she did not realize she had been holding. Behind the glass of the observation window, 2 residents stand shoulder to shoulder. She moves like she has been doing this for 10 years, one whispers. The other snorts. She looks like she just passed her boards. Age has nothing to do with it, the first one says. They both keep watching. Maya places a small piece of synthetic material to cover the opening, replaces the bone anchors, everything in place. She checks every clip, every line. No residual bleeding, no sign of swelling that cannot be managed. She steps back half a meter and looks at the monitors one more time. Heart rate, blood pressure, oxygen saturation, all where they should be. Close, she says. Only when the last stitch is tied does she realize there is a thin line of sweat running down her spine. The room no longer feels cold. In the scrub room, she peels off her gloves and masks the elastic snapping softly. For the first time since she walked into the operating room, she allows her shoulders to drop. In the pocket of her scrub top, something presses against her chest. She reaches in and pulls out a small worn coin. It is silver edges, nicked and dulled. The emblem of a naval medical unit is etched across its face, half rubbed away. A short piece of burned dog tag chain is threaded through a drilled hole. When the coin moves, the chain makes a faint, dry clink. She closes her fingers around it, feeling the familiar ridges. Nice work in there? The voice comes from the doorway. Elena Cruz, the charge nurse for the OR, leans against the frame, arms crossed, dark hair tucked under a cap. Her eyes are sharp, but not unkind. Thanks, Maya says. Elena nods toward the coin. Old habit? Maya tucks it back into her pocket. Something like that. Elena studies her for a moment as if weighing questions. She chooses one. You served. Maya reaches for the soap, turning the water on again, letting the heat soak into her skin. For a while, she says. Where? Maya looks at the stream of water, at the way it spirals into the drain. Places, she says. Overseas. Elena does not push further. Well, that kid on the table will get to complain about hospital food because of you. Not a bad start to a shift. She leaves. The door swings closed behind her. Maya washes until the last trace of iodine is gone from her hands, then dries them and steps into the hallway. Fort Kingsley is waking up fully now. Morning light slants through the tall windows, bright strips across the polished floor. Orderlies push carts. Nurses check charts on tablets. The smell of coffee drifts from the staff lounge. As she walks, conversations dip, then resume in slightly hushed tones. That the new neurosurgeon? Yeah, Thompson. What is she, 26? 29, I heard. Still, kids operating on kids. Someone laughs softly. Maya pretends she does not hear. Her stride stays even. She has long ago learned that reacting only feeds people who are looking for cracks. In the elevator, a captain in uniform stands beside her, the green of his jacket freshly pressed. He squints at the name on her badge. Thompson, new here. Yes, sir, she says. Neurosurgery. Yes. He lets out a low whistle. Big job for someone your age. She smiles politely, the practiced kind that reveals nothing. The elevator doors slide open at the main lobby. They step out into a flood of voices and movement. At the nurses' station near the neurosurgery wing, Dr. Richard Hale stands with a group of attendings, coffee in hand. His hair is silver at the temples, his posture immaculate. Framed awards and commendations line the wall behind him. Photographs of him shaking hands with generals and hospital board members. He spots Maya approaching. Dr. Thompson, he says, his tone smooth. I heard you took young Carter to the OR. Yes, sir, she replies. Small subdural. We evacuated it. He is stable. He takes a sip of coffee. Most would have observed and rescanned in 12 hours. Most did not see his pupil response, she says, or the subtle drift in his grip strength. Hale's eyes narrow a fraction. He does not argue the details. Well, he says, let us hope your instincts are as good as your confidence. We prefer not to turn routine training accidents into outcomes that require inquiries. There is a faint smile on his lips that does not reach his eyes. I will keep that in mind, Maya says. He turns back to his group. A few of them glance at her over the rims of their cups, then look away. At the end of the hall, Jenna waves her over. CT just called, the nurse says. Post-op scan looks clean. No new bleeding. For the first time since dawn, something in Maya eases. She nods. Thank you, she says. She walks to a quiet corner by a window and looks out. Beyond the parking lot, beyond the fences and guard posts, the Texas sky stretches wide and cloudless. In the distance, she can see the faint silhouette of a helicopter lifting off rotors, kicking dust into the air. Her hand slips into her pocket, fingers closing around the worn metal of the coin. One life, she thinks. For now, that is enough. By mid-morning, the hospital has settled into its familiar rhythm. Pagers chirp. Shoes slap softly against tile. Somewhere 2 floors down, a code is called, the words blurring into the constant hum of work. Maya stands at the edge of the neurosurgery conference room, tablet in hand, watching people file in. The room smells of coffee and dry erase markers. A projection screen glows at the far end, a frozen image of a brain MRI waiting for someone to care about it. Dr. Richard Hale takes his usual seat at the head of the table. The others arrange themselves without thinking, invisible lines of hierarchy drawing them into place. The older attendings sit closer to Hale. Residents and fellows drift toward the walls. Maya chooses a chair halfway down near the edge. Close enough to be part of the discussion. Far enough to feel like she could vanish if she wanted to. Morning, everyone, Hale begins. We have a full list today. Let us keep this efficient. He taps the laptop. The first case appears on the screen, a series of grayscale slices through a skull. 72-year-old male, chronic subdural, gradual onset confusion, he says. We will proceed with burr holes this afternoon. Any objections? There are none. The conversation rolls forward. Names, ages, lesion sizes, tentative plans. The doctors speak in shorthand. They know each other's patterns so well that suggestions are often understood before they are voiced. When the 5th case appears, something in the scan makes Maya sit up straighter. A younger woman, early 40s, small mass near the brainstem. The note on the side reads likely inoperable. Radiology suggests palliative care. Hale clears his throat. Given the location, we manage symptoms. Steroids, radiation consult. Surgery would be adventurous without clear benefit. The word hangs in the air, adventurous. Maya feels the coin against her hip, heavy in her pocket. She glances at the scan again. There is a narrow corridor of tissue, a sliver of space that might be exploited. Thin margin, but a margin all the same. She hears herself speak before she fully decides to. There might be a safe approach, she says. The room falls a little quieter. Not silent, but different. Heads turn toward her. Hale rests his hands on the table. Yes, Dr. Thompson. Maya swipes to enlarge the image. Here, she says. If we come in through a far lateral approach, there is a window between the vessel and the nerve tract. It is tight, but not impossible. One of the older surgeons sniffs. I have seen 3 attempts at that in the last 15 years. 2 of those patients never woke up. Maya nods. I know the risks. I have done a similar approach in a field setting. Different pathology, but comparable angle. Hale studies her. Where was this field setting? A forward surgical unit, she says. Overseas. A light stir goes through the room. The word overseas catches more attention than it deserves. Haley leans back. I appreciate the enthusiasm, he says. But here we operate inside a system. We have protocols for a reason. We do not experiment when the literature is against us. It would not be experimentation, Maya says, keeping her voice even. It would be a calculated risk with informed consent. Hale's smile is thin. Everything is a calculated risk, Dr. Thompson. The question is who calculates and who pays when the numbers are wrong. A small laugh bubbles up from the end of the table. It dies quickly when Hale does not join in. We will proceed with non-surgical management, he says. Next case. The scan disappears. The woman on the screen becomes a line on his list. Maya sits back. Her heart is not racing. She has had worse confrontations in rooms that shook with explosions. Still something in her chest tightens. Beside her, Noah Reed shifts in his chair. That was a gutsy pitch, he murmurs under his breath. Was it, she says. In this room yet, he answers. They do not like when the new person touches the map. She almost smiles. Maybe the map needs more roads. He looks at her curious. You really did that approach in a field hospital. She keeps her gaze on the screen, which now displays another anonymous brain. We did not have a radiology department, she says. Or a tumor board. Must have been rough, Noah says. It was loud, Maya replies, and crowded. Hale calls his name and Noah straightens quickly, answering a question about an upcoming lumbar case. The moment is gone, swallowed by the flow of plans. After the meeting, the group disperses in a swirl of white coats and muted conversation. Hale is called away by an administrator. The older attendings collect their coffee cups and their authority and drift back toward the operating rooms. In the hallway outside, conversations splinter. Did you hear her field setting? Probably some short humanitarian trip. I looked at her CV, Navy but not much detail. Recruiting must be desperate. At the edge of the cluster, a younger attending says, She was right about Carter this morning. The kid would have tanked overnight. Someone shrugs. Broken clocks and all that. Maya pretends she does not hear any of it. She walks toward the resident's workroom to check on overnight notes. The fluorescent lights overhead hum softly. The air smells faintly of instant soup and hand sanitizer. Noah catches up to her, a folder tucked under his arm. Dr. Thompson, he says, I have that post-op note for you to sign from Carter's case. She takes it and scans the page. You left out the initial change in grip strength, she says. I thought it was minor, he answers. It was not, she says, handing the paper back. If you miss the first small thing, you will miss the big one when it comes. He nods, cheeks coloring slightly. I will add it. Her tone softens. You did good work in there. He looks surprised for a second, then smiles. Thank you. Elena appears in the doorway, a pen tucked behind her ear. Conference over? She asks. Yes, Maya says. They did not tear you apart too badly. Maya shakes her head. I will live. Elena gives a small amused snort. Word of the morning you know is that you raised your voice in there. I did not raise my voice, Maya says. For them, disagreeing with Hale is the same thing, Elena replies. You will get used to it. Maya glances through the small window of the workroom. In the distance, Hale is talking with a hospital executive, both men framed by the glass wall of the administrative wing. Their gestures are measured, their faces composed. How long have you worked with him? She asks. 10 years, Elena says. He is good, brilliant even, but he plays it safe when he can. He has a lot to lose. And the patients, Maya asks. Elena holds her gaze for a moment. They do not always know what they are losing, Elena says. The midday rush builds. Maya spends the next hours checking on her post-operative patients. Carter is awake and grouchy about the noise in the ward, which she takes as a good sign. An older woman with a clipped aneurysm thanks her twice and then falls asleep mid-sentence. A middle-aged man recovering from a tumor resection cannot remember what day it is, but remembers his dog's name and says it 3 times as if he is afraid it might vanish. In each room, the monitor rhythms are different, but the sound is always there in the background. Beep, beep, beep. It threads through her day like a second pulse. At one point, she steps out of a room and nearly collides with a volunteer, pushing a cart of library books. Sorry, doctor, the woman says, backing up. I did not see you. It is fine, Maya says. The woman glances at her badge. Thompson, are you the new neurosurgeon everyone is talking about? Maya arches an eyebrow. Depends on what they are saying. The volunteer chuckles. You look too young, they say. That is the main complaint. It is the same thing they said about every new face who turned out to be very good at their job. Maya feels the edge of the coin in her pocket pressing against her palm. I will try not to disappoint, she says. By late afternoon, the light outside has shifted, turning the sky a harsher blue. The shadows in the hallways stretch longer. The day feels older, worn at the edges. At the nurse's station, Elena is updating a chart. She looks up as Maya approaches. You on call tonight? Elena asks. Yes, Maya says. Neurotrauma. Good, Elena says. If anything comes in, I would rather have you than some of the cowards upstairs. Maya glances at her, surprised by the bluntness. Cowards, she repeats. Elena taps the chart with her pen. People who say no before they even look at a problem. Maya says nothing. She watches as a transport team wheels a patient toward imaging the gurney, gliding along the corridor. A helicopter passes somewhere outside its low thrum, vibrating faintly through the windows. The hospital keeps moving, unaware of the shift that has started in a few minds. Rooms fill and empty, lights blink, monitors sing their electronic lullabies. In the fabric of Fort Kingsley, small threads of doubt and curiosity begin to twist around Maya's name, pulling it a little tighter into the pattern. The night shift begins with a quiet that never lasts. By 8, the sky outside Fort Kingsley has turned the color of cooled steel. The daytime noise has thinned to a lower murmur. The cafeteria is half lit. The main lobby feels hollow, as if the building has taken a breath and is holding it. In the neurosurgery call room, Maya sits at a narrow desk with her back to the wall, reviewing imaging from earlier cases. The screen casts a pale glow on her face. Her stethoscope hangs from a hook beside the door. Her on-call pager lies on the desk mute for the moment. She rubs her eyes and leans back. The mattress in the corner looks tempting in a tired, lumpy way. Instead, she reaches into her scrub pocket and takes out the coin. The metal is cool against her fingers. She turns it once, twice, tracing the worn emblem. The faint rattle of the attached chain is the only sound in the room besides the hum of the air conditioning. The pager vibrates. It buzzes against the wood with a small, urgent jitter. Maya picks it up and reads the numbers. The caller ID is not a single extension. It is the hospital-wide priority code. Before she can dial back, the overhead speakers crackle on. Attention, attention. Mass casualty alert. Repeat mass casualty alert. Incoming military transport, multiple criticals. All trauma surgery and critical care personnel report to emergency department. The voice is calm, but the words sink into the building like a shockwave. Maya's already moving. The coin disappears into her pocket. She grabs her white coat from the back of the chair and pulls it on over her scrubs as she steps into the hall. The corridor that had felt half empty 10 minutes ago is now full of people. Nurses hurry past with carts. 2 residents jog by trying to look like they are not running. A radiology tech slips into the stream badge, swinging against her chest. Elena comes out of a side stairwell, tying her hair back tighter under a disposable cap. "You got the page too," she says, falling into step beside Maya. "Yes," Maya says. "Any details?" "That was the detail," Elena answers. "They will tell us more in the bay." They reach the elevator and find it already packed. A respiratory therapist holds the doors with his arm sweat beading on his forehead. "Plenty of room for heroes," he says. Maya and Elena wedge in, pressed against a wall of fabric and plastic. The elevator hums downward. Someone in the back mutters, "Last time we had a mass casualty, it was a bus pileup on the interstate." "Different call," another voice replies. This one said military transport. The elevator doors open onto the emergency department and the air changes. It is thicker here, heavier with noise and motion. The sharp scent of antiseptic mingles with the metallic hint of blood and the faint sting of burnt rubber from gurney wheels. The main trauma bay has become a gathering point. Surgeons, anesthesiologists, nurses, techs, military, police, hospital administrators. A large digital clock on the wall shows the time in red numbers. Under it, a whiteboard has been cleared, ready to receive names, numbers, statuses. At the center, Dr. Aaron Blake, the chief of trauma, stands with a clipboard. He raises his voice just enough to cut through the buzz. "Listen up," he calls. "We have a downed aircraft 10 miles north of base. Air Force transport, multiple crew and personnel. Estimated arrival of first wave in 7 minutes. We do not have a final count yet. We do know there is one high-level VIP on board." A few people exchange quick looks at that. "What kind of VIP?" someone asks. Blake glances at a uniformed officer beside him who steps forward. The officer has dust on his boots and a streak of something dark on his sleeve that might be oil or dried blood. "Major Collins," he says by way of introduction. "From the base. The aircraft was carrying General Cole Harrington." The room absorbs the name. Harrington is not just a general. He is the general. His image has appeared in news clips, briefing photos, recruitment posters. The man who planned air campaigns. The man whose decisions sent jets into hostile airspace. "His condition?" Blake asks. "Unstable, that," Collins answers. "Severe head trauma reported at the scene. They are working on him in the helicopter. 2 crew dead at Site 4, Critical 3, walking wounded. Weather is clear. No delay on transport." Blake nods once. "We will treat him as we treat everyone. Fast, and by the book. Neuro, I want you ready for immediate evaluation. Where is Hale?" "On his way," someone says. Maya steps a little closer. "I am on call for neurotrauma," she says. "I am here." Blake looks at her, then at the uniform on Collins, then back at her. "You are Thompson," he says. "You did the quick craniotomy on the training accident this morning." "Yes," she says. He gives a clip nod. "Good. Stay near Bay 1. That is where they will bring Harrington if he is alive when he gets here." Around them, the staff breaks into organized motion. Nurses prep trauma bays, ripping open packages, hanging fluids, checking suction. Respiratory sets up extra vents. A pharmacist wheels up with a mobile cart of emergency meds. The noise rises. Somewhere outside, the low rumble of helicopter rotors begins to reach them, a vibration in the floor, more than a sound at first. Helena touches Maya's elbow. "You ready?" she asks. Maya inhales slowly. The air tastes like plastic and adrenaline. "I am on call," she says. "I am ready." They move to Bay 1, a large space at the far end of the department. It is cleared out now, the bed stripped, fresh sheets in place. Monitors hang on articulated arms. The overhead light waits dark and round. Maya checks the equipment herself. She tests the monitor, leads glances at the crash cart, looks at the intubation tray. Noah appears at her side, breathing a little hard. "I got pulled from clinic, Pol," he says. "You think they will let me stay in here?" "You are neuro," she says. "Stay until someone kicks you out." He grins briefly, then wipes his hands on his coat as if suds might appear. The overhead speakers sound again. "Helicopter incoming. Arrival in 3 minutes. All trauma teams to assigned bays." Maya can feel her heart beating a little faster. Not racing, just alert. Outside, through a small high window, the rotating lights of an ambulance paint a brief red stripe on the ceiling. The first wave arrives in a series of jolts. A gurney bursts through the doors, pushed by paramedics with wind-burned faces. A man in a shredded flight suit lies on it, pale afield, dressing wrapped tight around his thigh. He goes to Bay 2. Another follows, coughing, eyes wild from smoke inhalation. Then another motionless, except for the rise and fall of a ventilation bag. Maya focuses on Bay 1. It stays empty for a long minute that feels stretched thin. Then she hears it, the harder slap of boots, the urgent rhythm of wheels moving faster than usual. "Incoming VIP," someone calls. The gurney that comes through the door this time is surrounded by more uniforms. 2 flight medics in helmets, a military police officer, a nurse already starting a second line. The man on the gurney does not look like any poster. He looks like any other broken body. His face is gray with blood and soot. His hair is matted to his scalp. A cervical collar wraps his neck. His eyes are closed, lashes clumped. One side of his skull bulges under a soaked dressing. "General Harrington," Blake asks over the noise. "Yes," one of the medics answers, panting. "Unconscious since crash. GCS 6 on scene. 1 episode of arrest in flight. We got him back." They swing the gurney against the bed. Hands reach in from all sides. In one practiced motion, the team lifts and transfers him to the hospital mattress. The monitor leads snap-on. Numbers appear on the screen, shaky but there. Heart rate, blood pressure, oxygen. The beeps are irregular at first, then settle into a fragile pattern. "Neuro, you have him," Blake says. Maya steps forward until she is at the head of the bed. She can smell jet fuel smoke sweat. The general's skin is cold under her gloved fingers as she checks his response to pain his pupil size. "Right pupil sluggish, left blown," she says. "We need imaging now." Hale strides into the bay, still shrugging into his coat. His expression is composed, but his eyes sharpen at the sight of the patient. "What do we have?" he asks. Blake summarizes in clipped phrases. Crash, head trauma, arrest in flight, resuscitated. Haley looks at Harrington's face, at the blood-soaked dressing at the monitor. "Scan him," he says. Maya's already writing the order. CT head stat, full trauma series. The transport team wheels the bed away, monitors rolling beside them like nervous attendants. As the doors to radiology close behind the group, the noise in the emergency department swells around the sudden gap they leave. For a moment, Maya stands still in the wake of it, the smell of fuel and metal still in her nose, and the image of Harrington's uneven pupils stamped behind her eyes. She feels the coin against her leg, as if it has shifted, reminding her it is there. Elena touches her shoulder from behind. "We will meet them at CT, she says. Maya nods once and moves toward the imaging wing, following the echoes of the gurney wheels down the corridor. The CT suite is colder than the rest of the hospital. The air feels thinner, washed clean by machines. General Harrington lies on the narrow table, a flimsy hospital sheet over his uniform trousers. His boots are gone. Someone has cut his shirt away, leaving shreds of fabric under the edges of the monitors. His dog tags rest against his chest, pushed aside by tape and tubing. The scanner circles his head with a low, mechanical hum. A ring of light passes over his face again and again. His eyes stay closed. Maya stands in the control room behind the glass arms, folded, watching the images bloom one by one on the screen. Cross-sections of his skull appear in pale gray. Bone, blood, brain. The radiology tech glances at her. "We are almost through," he says. She nods, her jaw tight. The first few slices show scattered fractures, a small line at the frontal bone, a thicker one along the parietal. Then the bleed becomes clear. A dark spreading cloud under the skull, pushing the brain aside. Near the center, the ventricle is compressed, almost slit thin. The radiologist on call leans in, his glasses slipping down his nose. Several contusions. Subdural, epidural, probably diffuse axonal injury as well, he says. This is ugly. We knew it was ugly, Maya says. He scrolls through the images. If he survives the next hour, it will be a miracle. Behind them, the door opens. Dr. Hale steps in, followed by 2 other neurosurgeons. Their faces are lined, their coats marked with the subtle wear of long practice. Hale looks at the screen. For the first moment, he says nothing. That is a lot of blood, one of the others murmurs. Haley gestures for the tech to scroll back. He studies the midline shift, the distortion of structures that should be centered and balanced. How long since the crash? He asks. About 40 minutes, Maya says. He arrested once in flight. They brought him back. Vitals now, marginal, but holding. Hale exhales slowly through his nose. Angie, he says to the radiologist, save this series to the shared drive. We will need it upstairs. He turns and leaves without another word. Within half an hour, the general is in the intensive care unit, hooked up to more machines than a regular patient would see in a month. Ventilator, multiple lines, monitors tracing out his heartbeat, his pressure, his oxygen, his intracranial pressure. Maya stands at his bedside while the nurses finish connecting the last of the drips. She checks his pupils again, looks at the numbers on the AIC tube. The beep of the monitor is now a jittery high-wire sound. Neuro wants a full conference in the consult room, the ICU charge nurse tells her. They are reviewing his scans now. I will be there, Maya says. She rests her hand for a brief moment against the rail of the bed. The general does not move. The ventilator sighs and rises, sighs and rises. The consult room is upstairs near the neurosurgery offices. It is usually used for family meetings, for consent discussions, for breaking news that alters lives. Today, the table is crowded with white coats. Hale sits at the head, his laptop open. The images of Harrington's brain are projected onto the wall, larger than life. 8 neurosurgeons are present, counting Maya. She takes a seat near the far end with a view of both the screen and the door. The door stands slightly open. Outside in the hall, Maya can see a few uniformed figures waiting, backs straight, faces stiff. Base representatives, administrators. They do not join the discussion, but they listen. Hale clears his throat. We are here to discuss the case of General Cole Harrington, he says. Severe head trauma following aircraft crash. You have all seen the preliminary scans. He taps a key. The projection shifts to a midline slice, the dark mass obvious against the pale brain. Acute subdural hematoma with significant midline shift. Multiple contusions. Likely diffuse injury, he continues. He has already experienced 1 cardiac arrest and required aggressive resuscitation. His current neurological status is poor. Glasgow Coma Scale of 5. At the other end of the table, Dr. Singh, a senior neurosurgeon with a reputation for precision, leans forward. What is his current intracranial pressure? She asks. Fluctuating, Hale says. Elevated despite maximal medical management. Singh nods slowly. Surgical decompression would be technically possible, she says. But with this pattern of injury, the question is whether we are changing his long-term outcome or simply prolonging his acute phase. One of the others, Dr. Morales, shakes his head. We open his skull, we expose him to massive blood loss instability. Even if he survives the operation, there is a very high chance of severe disability if he emerges at all. Another doctor speaks. And if he dies on the table, we will have taken a 4-star general into an elective disaster. The word elective hangs like a stone. Maya listens, her hands folded on the table. Her coin rests in her coat pocket, pressing against her side. Hale looks around the room. I want honest opinions, he says. Purely medical. Should we operate? Dr. Singh is the first to answer. If this were a private citizen, not a general 80 years old instead of 60, I would recommend no surgery. Comfort measures. Let nature take its course. This is not a private citizen, Morales says, and that is the very reason we must be conservative. The scrutiny will be intense. If we operate and he dies, there will be questions about our judgment, our indications, our motives. Are you saying we should not operate to protect ourselves? Someone asks quietly. Morales meets his eyes. I am saying we have to look at risk and benefit, for him and for the institution. A 4th surgeon lifts his hands. The probability of returning him to meaningful independence is extremely low. The literature is clear. These injuries do not end well. Hale nods slightly with each statement, as if confirming something he has already thought through. Maya, says Dr. Singh, turning toward her. You have been at his bedside. Do you see any sign we are missing? All eyes shift to her. He is unstable, she says. His pupils are unequal. His reflexes are scant. From a cold standpoint, his prognosis is poor. She pauses. The images of the scan are stark on the wall. She thinks of tents filled with dust of men bleeding through makeshift bandages, of triage decisions made under mortar fire. But I have seen patients with scans like this walk again, she adds. Several eyebrows lift. In a forward unit, she continues, We do not have the option to send someone home to hospice. We operate or we watch them die. Sometimes they die anyway, sometimes they do not. Hale's voice hardens a touch. War zones are not a standard of care we should import here. No, Maya says, but the anatomy is the same. There is a flicker of something across a few faces, curiosity, irritation, it is hard to tell. Hale looks around the table. Let us keep this focused, he says. We are not here to debate philosophy, we are here to decide whether the benefit of surgery justifies the very real risk. He glances at each of the senior surgeons in turn. Dr. Singh, he prompts. She hesitates, then says, I would not recommend surgery. Dr. Morales. No surgery. The answers follow one after another. No, no, not advised. One by one, the majority declines. When it is quiet again, Hale folds his hands. My own assessment aligns, he says. The cranial damage is extensive. The likelihood of meaningful recovery is extremely low. Medical management is already at its maximum. Operating would expose him to the risks of decompression without a significant chance of benefit. He looks at the door for a second, then back at the group. Our recommendation should be that we do not pursue neurosurgical intervention. We will continue supportive care and keep his family informed. If there are no strong objections, I will present this to administration. The silence that follows is thick. Nobody speaks immediately. Maya feels the coin dig into her ribs. It is as if someone has shifted its edge. In other words, Morales says, breaking the silence, this patient cannot be saved. Attempting surgery would be a waste of resources. The phrasing sparks a spark of heat behind Maya's sternum. Hale does not correct him. Very well, he says. If there are no dissenting votes, we will close the discussion. He begins to close the laptop. Maya hears her own voice. I dissent, she says. The word is not loud, but in the quiet room it carries. Hale looks up slowly. Excuse me, he says. Maya meets his eyes. Her heart thumps against the coin in her pocket. I do not agree that surgery is a waste of resources, she says. I do not agree that this patient cannot be saved. The other surgeons shift in their seats. The air feels charged, sharp. Hale's expression tightens. Dr. Thompson, this is not the time for abstraction, he says. Do you understand the complexity of what you are suggesting? This is not a simple decompression. This is a 4-star general with multiple brain injuries and a compromised cardiovascular status. I understand, she says. Do you understand what it means politically, publicly, if he dies in our operating room after we chose an aggressive path against the consensus of senior staff? He asks. She does not look away. I understand that if we do nothing, he dies in the ICU with his brain slowly crushing itself, she says. If we operate, he might still die, or he might not. Hale's jaw moves as if he is grinding down a response. This is not a training exercise, Moz, he says. Your name would be on the consent, your responsibility. Maya feels the entire weight of the room leaning toward that statement. Responsibility, risk, reputation. Her hand curls in her pocket around the coin until the ridges press into her skin. I know, she says. I know, she says. The room holds its breath. For a moment, nobody moves. The images of Harrington's brain remain frozen on the wall, the dark mass and the crooked midline, like a storm caught in glass. Hale closes his laptop halfway but does not shut it. The hinge pauses. Then let me make this clear, he says. Are you, Dr. Thompson, formally proposing that we take this patient to surgery? Maya hears the layers in his question. Medical, legal, political, personal. I am, she answers. One of the senior surgeons lets out a quiet, disbelieving sound, something between a laugh and a cough. You have been at this hospital, 3 months, he says. You have never led a case like this here. No one here has led a case like this here, Maya replies. Crashes like this do not happen in scheduled blocks. Hale's gaze sharpens. Experience is not something you can wish into existence, he says. No, she says. It is something you bring with you. The words land heavier than she intends. A few pairs of eyes flick toward her, then toward Hale. Before anyone can speak again, there is a knock at the door. It swings inward a few inches. The uniformed officer from the emergency bay, Major Collins, stands there. Behind him, a hospital administrator in a dark suit waits his tie slightly askew. Is this a bad time? The administrator asks. Perfect time, Hale says, his voice flat. We are just concluding. He turns more toward them, presenting his profile, the calm authority of someone used to being the one who delivers decisions. Our consensus, he says, is that the general's injuries are not surgically salvageable. We recommend maximal medical management and comfort measures. Operating would not meaningfully alter his prognosis and carries a very high risk of intraoperative death. Collins listens with his jaw set. The administrator nods, face carefully neutral. So that is it, Collins asks. You are saying there is nothing you can do. We have done and will continue to do everything that is medically appropriate, Hale says. Sometimes the best care is knowing when to stop. The phrase rubs against something raw in Maya. She pushes back her chair and stands. I am not ready to stop, she says. Heads turn again. Dr. Thompson, Hale says quietly. The administrator looks from one to the other, senses the fissure forming. Perhaps we should step out, he suggests. Colin steps fully into the room instead. No, he says. If you have disagreement, I would rather hear it in the open. Hale's mouth thins, but he does not object. Maya squares her shoulders. She can feel the room watching, weighing her. I agree that his condition is critical, she says. I agree that his prognosis is grim, but I do not agree that surgery cannot help him. The scan shows a large subdural hematoma causing mass effect. If we relieve that pressure, we give his brain a chance to recover from the rest. A very small chance, Morales says, with massive risk. Small is not the same as zero, she replies. Mathematically, no, he says. Clinically, for someone of his age, with his pattern of injury, the outcome data are very clear. Maya looks at Collins. What has his family been told? She asks. They were notified of the crash, he says. They have been told his condition is critical and that he is at this facility. That is all. They are en route. Hale interlaces his fingers. I will be the one to inform them of his situation and our recommendation, he says. And if they ask if there's any surgical option, Maya says. There is always an option, Morales mutters. We are saying it is not a wise one. The administrator clears his throat. Forgive me, he says. I am not a surgeon, but are you saying there is technically an operation that could be attempted? Yes, Hale says reluctantly. Technically, a large decompressive craniectomy to evacuate the subdural and reduce intracranial pressure. It would be extensive. And you are saying no one here is willing to perform it, the administrator asks. Hale hesitates for the first time. We are saying that collectively we do not recommend it, he says. I am willing to perform it, Maya says. The sentence lands in the center of the table. Hale turns to her with a look that is equal parts disbelief and alarm. This is not bravado, she says. I have led decompressive cases in worse conditions than this. Limited resources, unstable patients, under fire. Those are not comparable, Hale says. This is not a battlefield tent. This is Fort Kingsley. We answer to boards and committees and review panels. Brains bleed the same way in sand and in tile, she says. The administrator's eyes linger on her. Dr. Thompson, you feel confident you can attempt this surgery, he asks. I feel confident in my ability to perform the procedure, she says. I do not promise an outcome. None of us can. Collins shifts his weight. His boots are still dusty. General Harrington has never been the kind of man to choose the safest option just because it was safe, he says quietly. The administrator looks uneasy. We have to consider the institution, he says. The public perception, if we are seen as acting recklessly. Reckless would be cutting without understanding what we are doing, Maya says. This is not that. It is high risk, but it is not reckless. Your confidence is admirable, Hale says. But confidence does not keep a blood pressure stable when half the cranial vault is open. It will be my department, my operating rooms, my name on the line as well. You can have your name removed from the consent, she says. List me as primary. I will take responsibility. Several people inhale at once. It feels like the oxygen in the room has thinned. Hale stares at her. You do not know what you are offering, he says. I do, she says. I know what it is like to sign a chart and wonder if someone will come looking for you later. Their eyes lock. The sounds from the hall filter in distant footsteps, a phone ringing a muffled overhead page. For a second, Maya hears something else layered under it, faint and ghostly. The echo of a generator, the high whine of a drill in canvas walls, the pounding of artillery far too close. The administrator straightens his tie. Let me be practical, he says. If we authorize the surgery and the general does not survive, the question will be why we did not follow the consensus. If we do not authorize it and he dies anyway, the question will be whether we withheld a possible intervention. There is no outcome that is clean, Collins says. Ask yourself which one you can live with. Hale pinches the bridge of his nose. When he looks up, some of the heat has drained from his expression, leaving something more complicated. If we proceed, there will be strict conditions, he says. Full documentation that the risks were explained. Clear notation that this is outside standard recommendation. Understood, Maya says. The administrator hesitates. I do not have the authority to forbid a surgeon from operating if they accept full responsibility and the family consents, he says. The hospital can issue guidance, but we cannot physically stop you from picking up a scalpel. He looks at Hale. Do you intend to block her? Hale is silent for a long moment. No, he says finally. I will not block her. I will not endorse this, but I will not stand in the doorway. He turns back to Maya. You truly want this case? He asks. No, she says. I do not want any case like this, but he is here and we are here. It is not defiance, it is simply true. Collins shifts his stance. Some of the tightness in his shoulders eases. If he could answer, I know which choice he would make, he says. He has never been afraid of bad odds. The administrator exhales like a man stepping off a ledge and hoping there is ground. Then we proceed, he says. Dr. Thompson, you are authorized to attempt the operation, but understand formally and clearly that if this goes wrong in any public way, you will carry the brunt of it. I understand, she says. Haley looks at her with an expression that is almost a question. Do you? He says. Maya meets his gaze. I have already buried more than one decision, she says. This will not be the first one I remember at 3 a.m. He does not know what to do with that answer. The administrator slips out into the hallway, phone already in hand, no doubt, calling someone in another office to explain that the die has been cast. Collins nods once to Maya, the smallest of salutes, and then leaves to inform whoever needs informing on the base. The room empties out, some of the surgeons shaking their heads, others avoiding her eyes. Singh gives her a brief, searching look, then speaks low as she passes. I hope you are right, Singh says. I hope I'm at least not wrong, Maya replies. Soon only Hale and Maya remain. He closes the laptop fully this time. The soft click sounds final. I will observe from the gallery, he says. I will ensure you have whatever resources you require. Thank you, she says. Do not thank me, he replies. Save him, or at least do not kill him, and then we can discuss gratitude. He leaves. The hallway outside feels narrower than it did an hour ago. The same lights, the same paint, but everything seems sharper. Maya walks toward the stairs, not waiting for the elevator. Her steps are quick, but steady. The fabric of her coat brushes against her legs. Her hand finds its way into her pocket. The coin is warm now from her body heat. She threads her fingers through the burned piece of chain, remembers the day it changed from decoration to relic. A different tent, a different table, a different man whose brain swelled against bone while dust fell from the ceiling like ash. She had refused to evacuate then, too. In the scrub room outside operating room 1, she stands for a moment with her back to the tiled wall. The hum of the ventilation system fills the space. The smell of chlorhexidine and soap is strong, cutting through the ghost of jet fuel in her nose. Elena is there, already snapping on a cap, her eyes watching Maya through the mirror. So, Elena says, we are doing this. We are, Maya answers. I heard some of it, Elena says. Thin walls, thick opinions. Maya steps to the sink and turns on the water. It rushes over her hands hot at first, then settling into a steady warmth. She scrubs in slow circles, fingers, palms up to her elbows. The ritual is as automatic as breathing. They all said no, Elena continues. You said yes. The water swirls soap down the drain, taking with it the faint traces of the day. They said the odds are bad, Maya says. They are right. But you still said yes, Elena says. Maya does not look up from her hands. I have seen worse odds, she says. Sometimes they work anyway. Elena studies her in the mirror. You are not from here, she says. Maya glances at her reflection. Texas, she asks. This comfort with chaos, Elena says softly. It is not native to this building. Maya turns off the tap and lets the water drip from her fingers. I used to work in noisy places, she says. She steps back, holds her arms up slightly while Elena helps her into the sterile gown. The fabric rustles against her skin. Gloves snap into place over her hands, forming a second pair of fingers. Through the glass, she can see the team preparing the room. The anesthesiologist checking his lines, the scrub tech laying out instruments in a precise metal array. The overhead lights hang like blank eyes. Do you want music? Elena asks. Maya shakes her head. No, I want to hear the machines. Elena nods once. We will be right there with you. As they move toward the door, the monitors in the operating room flicker into brighter numbers. Heart rate, pressure, oxygen. The digital green and white glow in the dimmed space. Maya feels the coin pressed against her ribs, the weight of it like a promise she did not speak out loud. She pushes through the door into the theater of lights and steel toward the table where General Cole Harrington waits, caught between what has already happened to him and what she will do next. Operating room 1 feels different when Maya walks in this time. It is not the equipment. The machines are the same. The overhead lights cast the same cold, pure circles. The air holds the same blend of antiseptic, warmed plastic, and the faint metallic hint of instruments waiting to be used. It is the attention. There are more people than usual. An extra circulating nurse, an anesthesiologist with a fellow at his shoulder, a perfusionist on standby just in case. In the gallery above, behind the glass figures, have already gathered. Silhouettes of white coats and uniforms, faces pale in the reflected light. At the center of the room, General Cole Harrington lies on the table. He is draped in sterile blue from the neck down. Only his head and part of his chest are exposed, framed by green towels. The ventilator tube curves from his mouth. His skin has been scrubbed, leaving faint pink streaks among the bruises. A temporary dressing holds where the field bandage had been. Maya walks to the anesthesia station first. How are we doing? She asks. The anesthesiologist, Dr. Patel, glances at his monitors. Blood pressure is low but tolerable. Heart rate is elevated. Vent settings holding. We are pushing mannitol and maintaining sedation. Any new arrhythmias? She asks. Some ectopy in transit, but nothing sustained, Patel says. He is fragile, but he is here. Maya nods. Let us keep him here. She crosses to the patient. For a moment, she simply looks at his face. Without the grime and the chaos of the emergency bay, he seems almost ordinary. A man in late middle age lines around his eyes a scar near his jaw that looks old. The only sign of rank now is the dog tag chain taped aside. Her hand rests briefly on his shoulder. General, she says softly, barely above a whisper. It is Dr. Thompson. You have been here before, just not in this room. We are going to try this again. The scrub nurse, a tall man named Harris, peers at her for a second, then pretends he did not hear. All set, doctors, Harris says. Instruments counted, blood products ready, neurosurgery carts stocked. Invasive lines confirmed, Patel adds. We have access for volume and pressors. Maya looks toward the glass of the gallery. She can see Hale there, arms folded, expression unreadable. Beside him stand two other neurosurgeons and a hospital administrator. Further back in the shadows, there are uniforms. She does not wave, she does not nod. She focuses on the field. Let us start, she says. The lights over the table brighten. The room seems to contract around the rectangle of skin on Harrington's head. Time, Harris says, glancing at the wall clock. 16:32. Maya takes the marking pen and traces her planned incision, a wide arc across the side of the skull. It will not be pretty. It does not need to be. She takes the scalpel. The first cut is always deceptive. Skin yields cleanly obedient as long as the hand is sure. She opens the tissue in one smooth movement. Blood wells up along the line, dark and immediate. Suction, she says. The nurse moves without being told twice. The thin tip slurps away the blood in a steady stream. She exposes the bone, then takes the cautery to seal small vessels in the scalp. The air fills with a faint, burnt smell. She calls for the craniotomy. The drill vibrates through her hand as it eats into bone. The sound is a high, constant whine that threads through the lower drone of the ventilator and the steady beeping of the monitors. Closing in on the sinus, Harris warns. I see it, Maya says. She creates burr holes at the edges of her planned flap, then connects them carefully. The bone lifts in a large, curved section, exposing the dura beneath. The membrane bulges outward, tight and pale, straining against the pressure beneath it. Dr. Patel glances at his readings. ICP is climbing, he says. Of course it is, Maya replies. We are about to fix that. She uses a small hook to tent up the dura, then makes a long incision. The membrane opens. The room reacts. Blood surges out in a thick, urgent wash, dark and under pressure. It spills into the cavity, runs toward the suction tip, stains the surrounding drapes. Oh God, one of the younger nurses breathes. Maya does not flinch. More suction, as she says. Lap pads, keep the field clear. Harris obliges, moving quickly but controlled. The suction gurgles. Bloody fluid rushes away through the transparent tubing. For a few seconds, visibility is poor. It is like trying to see through a storm. Then the flow slows, and the brain begins to appear swollen, pale, pulsing slightly with each beat of the heart. There, she says. That is the hematoma cavity. She inserts a soft catheter and begins to evacuate the clot, drawing it out in slow, controlled pulls. The dark mass recedes, revealing once hidden structures. ICP trending down, Patel reports. Good. Keep me updated, Maya says. In the gallery, Hale leans forward, forearms resting on the rail. One of the other surgeons murmurs something to him, but he does not answer. Maya moves methodically. She identifies torn bridging veins, clamps, and coagulates them. She inspects the cortical surface for active bleeds. Each movement is measured. Each decision is a choice between speed and precision. 40 minutes in, with the bulk of the clot, remove the numbers on the monitor shift. Blood pressure dropping, Patel says, his voice tightens. Systolic below 80, heart rate climbing. More fluids, Maya says. Check hemoglobin. We have already transfused 2 units, the anesthesiology fellow says. Another C. Patel orders. Start pressors. I do not like this pattern. The heart rate spikes, then stutters. The waveform on the monitor becomes more erratic. Rhythm looks ugly, the fellow says. Frequent PVCs. The overhead lights glare off the metal instruments. The room feels warmer, though the temperature has not changed. In the gallery, Hale exhales through his teeth. She is losing him, he says under his breath. Maya hears none of that. She is watching the surgical field and the monitor at the same time, shifting her focus by fractions. Any tamponade, any sign of a cardiac injury, she asks. No, Patel says. This is global instability. He is circling the drain. The heart rate spikes higher, then suddenly falls. The jagged peaks on the ECG flatten into a wavering line. The sound changes. The beeps smear into a long, continuous tone. The room freezes. For a heartbeat, everyone stops. Ventricular fibrillation, the fellow says, voice high. He is out. Patel reacts first, as he is trained to do. Stop for a moment, he says. We need to code him. Maya's hands lift from the field, but she does not step back. Her eyes are on the open skull, the brain that has only just started to relax. In a corner of her mind, something familiar unfolds. A memory rises, triggered by the sound of the flatline. Canvas walls. A dust-filled beam of light. A young soldier whose heart stopped while his brain swelled under her fingers. Another table. Another time she had refused to walk away. Not yet, she had thought then. Not yet, she thinks now. Charge the defibrillator, Patel says. Wait, Maya says. Her voice is calm, but it cuts through the noise. We are not stopping. Patel looks at her with disbelief. His heart is not beating, he says. We cannot operate on a corpse. He is not a corpse, she says. Start compressions. Prepare to shock. I will continue evacuating and securing. If we get his heart back and his brain is still trapped, we will have done nothing. Elena, standing at the side of the bed, places her hands on the general's sternum without hesitation. Starting compressions, she says. She begins to press steady and deep, counting under her breath. Charging to 200 joules, the fellow says. Maya turns back to the field. She looks at the small pool of blood that has collected again at the vein that is still oozing from the edge of the dura. Clamp, she says. Harris hands it to her. His eyes flick toward the monitors and then back again. Patel shakes his head but does not argue. On your call, he says. Maya watches for a small opening between compressions. Clear, she says. Elena lifts her hands. The paddles press to the general's chest. The body jerks slightly as the shock runs through him. The monitor waveform quivers, then returns to a flat, accusing line. Still in V-fib, the fellow says. Resume compressions, Patel orders. Sweat beads at Elena's hairline. She sets her shoulders and begins again. Her arms pump strong and relentless. Maya continues to work inside the skull. She finds another small bleeder and seals it. She gently lifts a swelling lobe to check for deeper clots. Every motion is careful. The brain is less tense now, but vulnerable. Charging again, the fellow says. 250 joules. The sound of the ventilator is louder in the pauses between beeps. Maya closes her eyes for a fraction of a second. Not to pray, just to gather. Clear, she says again. Another shock, another jolt. The line on the monitor bumps, stutters, breaks. For 2 seconds, nothing happens. Then small, irregular spikes appear. Come on, she whispers very softly. The spikes become more patterned. A weak, slow rhythm emerges. We have a pulse, the fellow says, relief cracking his voice. It is weak, but it is there. Blood pressure, Patel asks. 60 systolic, the fellow says. Creeping up. Keep the pressors going, Patel says. Support him. Do not let it collapse again. Elena steps back, breathing harder. She shakes out her arms once, then reassumes her position beside the table, ready. Maya does not let the fragile relief distract her. We are not out of anything, she says quietly. We bought time. Let us not waste it. She resumes her full attention on the field. The next 90 minutes stretch and compress in strange ways. Time becomes a series of small tasks. Identify a torn vessel. Control it. Remove a last fragment of bone pressing into tissue. Irrigate. Inspect. Reassess. Each step is its own world. The anesthesia team fights its own battle at the head of the bed. Volume adjustments. Vasopressors titrated up and down. Ventilator settings nudged this way and that. The numbers on the monitors swing, then settle, then swing again. They never become perfect, but they stay within a livable range. In the gallery, people come and go, but no one speaks loudly. They watch the small figure of Maya bent over the field, her hands precise and unhurried. At one point, Dr. Singh appears behind Hale. How is it going? She asks. She lost him for 2 minutes, Hale says. She brought him back. Singh watches for a long moment. She is steady, she says. She is stubborn, Hale replies. Sometimes that is the same thing, Singh says. Below, Maya begins the reconstruction. She lays a dural substitute over the exposed brain, suturing it in place, to recreate a protective layer where the original was too damaged. She positions the bone flap to the side instead of replacing it fully, leaving the skull open for swelling. She secures what she can, planning for swelling and subsequent procedures later, if there is a later. Check ICP, she says. Down to 20, Patel replies. Better than before we started. Good, she says. She irrigates one last time, watching for any sign of renewed bleeding. The field remains clean. Satisfied, she nods to Harris. Let us close, she says. They layer the tissues back together. Muscle, fascia, skin. The sutures cross the scalp in a long, curved line, neat even in its severity. As she ties the last knot, the monitors continue their steady song. Heart rate in the 80s, blood pressure acceptable, oxygenation stable. Harris checks his counts. All sponges and instruments accounted for, he says. No discrepancies. Thank you, Maya says. She steps back from the table. For a moment, she simply stands there, hands still raised, gloves flecked with dried blood. The realization of her own exhaustion arrives all at once. Her shoulders ache. There's a tight throb behind her eyes. Her back feels as if it has turned to a single line of tension. Time, Harris says. 2023. Total surgery duration 3 hours, 51 minutes. It felt longer, Elena mutters under her breath. Maya peels off her gloves carefully, rolling them down her wrists. Her fingers beneath are wrinkled and pale from the wash and the sweat. She removes her gown, letting it slide into the biohazard bin. She walks around to the head of the bed. General Harrington looks much as he did before, but something is different. The swelling has lessened a fraction. The dressing over his skull is fresh and bulky. The numbers above his head are less chaotic. Neurological exam will not tell us much yet, Patel says. He is heavily sedated. I know, Maya says. She studies him anyway. The lines of his face, the way his chest rises with the ventilator, the feeble but present pulse at his neck. We will take him back to ICU, the charge nurse says. We will keep him quiet and cold. Maya nods. Page me with any change, she says. As the team prepares to move the bed, the doors to the operating room open. Hale steps in from the scrub side, his mask hanging at his neck. His eyes scan the room, the table, the monitors. Then they find Maya. Well, he says. He does not sound triumphant. He does not sound chastened either. He sounds tired. You still have a general with a heartbeat. For now, Maya says. He looks at the blood-soaked drapes, then at the suture line on Harrington's head. How did you know when to keep going? He asks. She considers the question. She thinks of the moment the monitor went flat of Elena's hands on the chest of the decision to keep her fingers inside the skull instead of stepping back. I did not know, she says. I decided. He studies her for another moment as if trying to fit this answer into his world of protocols and probabilities. The staff moves around them, disconnecting lines from wall ports, securing tubing, preparing to roll the bed. The noise rises, the spell of the surgery breaking. Get some rest, Hale says finally. He is going to need you again if he makes it through the night. Maya nods but does not promise anything. As the bed begins to roll out of the room, she walks with it to the doors, then stops. The ventilator follows its sigh, matched by the soft squeak of wheels. When they are gone, the room feels suddenly larger, emptier. She reaches into her scrub pocket and finds the coin. It is warm, sticky, with the faint residue of glove powder and sweat. She closes her hand around it and lets her shoulders sag for the first time since she scrubbed in. The beeping in the room has quieted. Only one monitor remains on tracking nothing of importance, its slow pulse a background hum. Maya takes a breath, tasting the air that smells of blood and antiseptic and something else she cannot quite name, something like iron and relief. Then she turns toward the scrub room, pushing through the door to wash the last of the surgery from her skin. The first night after the surgery passes in fragments. Maya spends most of it in the intensive care unit, sitting in a plastic chair near Harrington's bed. The fluorescent lights hum softly overhead. The room is dim, except for the soft glow of monitors and the occasional flash from a passing cart in the hall. Harrington lies still, wrapped in linen and wires. His head is bandaged in thick white layers, the suture line hidden beneath. The ventilator lifts and lowers his chest in a slow, artificial rhythm. Above him, his numbers move in small, tentative patterns. Heart rate in the 70s, blood pressure marginal but steady, intracranial pressure in the low 20s. Every hour, the nurse on duty checks his pupils. Every hour, Maya leans in to look as well, watching for even the slightest change. Sometimes she writes notes. Sometimes she simply stares at the green and white numbers, listening to the soft beeps that have become the soundtrack of her day. At some point after midnight, Elena drops a blanket over Maya's shoulders. Your lips are blue, Elena says. You have been sitting under the air vents too long. Maya realizes her shoulders are tense with the chill she had ignored. Thank you, she says. You should sleep, Elena replies. I will, Maya answers. She does not. Near dawn, Hale appears at the door, hair mussed coat thrown on over a shirt that is not quite tucked. Any changes? He asks. Nothing dramatic, Maya says. He is holding. They stand on opposite sides of the bed, two figures with different histories staring at the same quiet face. Did you consider the possibility he would die on the table? Hale asks after a moment. Every minute, she says. He nods once, then leaves without another word. The second day blurs at the edges. Day and night flatten into one another. Nurses change. Residents trade places. The room smells of disinfectant and the faint sweetness of intravenous fluids. Outside the window, the Texas sky goes from pale to bright to dark again. They begin to lighten Harrington's sedation slowly, notch by notch. His body needs to rest, but his brain needs a chance to show what remains. By the time the third morning arrives, the air in the ICU feels restless. Maya is in the neurosurgery workroom when the call comes. Her phone buzzes against the table. She glances at the display. ICU. Thompson, she says. Doctor, this is Kelly in intensive, the nurse says. The general is showing more spontaneous movement, eye fluttering. I think you will want to see this. I am on my way, Maya says. She's already out of her chair before the call ends. The ICU corridors are quieter than the emergency department, but there is a different urgency here. Machines stand sentinel beside each bed. Tubing hangs in careful curves. The monitors in the hall blink like small, distant cities. At Harrington's door, she pauses for half a breath, then pushes in. The room is as she left it, yet not quite. The ventilator still sighs. The monitors still beep. The light from the window is softer, filtered by blinds. But his eyes are no longer fully closed. They move beneath the lids, small shifts under pale skin. Noah is at the foot of the bed, flipping through the chart. Kelly, the nurse, stands at the head, one hand on a ventilator tube. When did this start? Maya asks. About 10 minutes ago, Kelly says. He opened one eye halfway, then squeezed my hand when I asked. On which side? Maya asks. The right, Kelly says. Maya steps to the head of the bed. The bandages around his skull make his head look larger than it is. She leans close. General Harrington, she says. Her voice is low, steady. This is Dr. Thompson. If you can hear me, I want you to try to open your eyes. For a moment, nothing happens. Then his eyelids twitch. The right eye cracks open a sliver. The pupil is dark ringed with bloodshot sclera. It rolls slightly unfocused, then steadies. That is it, she says. Stay with me. You are in a hospital. You are safe. Safe is a generous word, but it is something to hold. Can you squeeze my hand? She asks. She takes his right hand in hers and wraps his fingers around her own. She feels the dry drag of his skin, the slack of muscles still under the weight of medication. For a second, nothing changes. Then there is a faint pressure, weak but deliberate. There it is, she says. Good. Noah watches eyes wide. That is more than I expected this early, he says. Do not say that out loud, Kelly mutters. Maya checks his pupils with a small penlight. The right constricts sluggishly. The left remains large and slow. It is not perfect, she says. But it is something. The general's gaze wavers, then slowly tracks toward her voice. His brow furrows a faint line between his eyebrows. He tries to speak. The tube makes it impossible. The attempt becomes a rough sound deep in his throat. You have a breathing tube in, Maya says. Do not fight it. You will hurt yourself. Just listen for now. His eyes focus on her face. She watches the shift from fog to something else, a flicker of recognition trying to surface through pain and sedatives and swelling. He stares. Her name badge is below his line of sight. He is not reading letters. He is searching features. Can you close your eyes once for yes, twice for no? She asks. He closes his right eye, then opens it. Once. Good, she says. Do you know where you are for yes, one blink? A pause, then one blink. Kelly and Noah exchange a glance. Do you know why? Maya asks. This time there is no blink, just a flicker of confusion. Expected, she says quietly. That is all right. It will come back in pieces. She's about to continue the exam when his gaze tightens. His fingers curl a fraction more around hers. His breathing changes shallow above the set ventilator breaths. Easy, she says. You are all right. His lips move around the tube-shaping air that cannot become words. The effort is visible in the tendons of his neck. Maya leans closer. What are you trying to say? She asks. His right eye, the one that can still contract, narrows. There is a stubborn focus there that cuts through the drugs. He makes a sound more forced this time, still mostly a vibration. Kelly frowns. He is going to fight the tube, she says. We can increase sedation again. Wait, Maya says. The general tries again. This time the sound has a hint of shape. Man? The word scrapes past plastic and dry tissue. Maya feels a jolt at the back of her skull, like a distant artillery impact. General, she says. Do not strain. You are intubated. You will injure your throat. He shakes his head just barely. His eyes lock on hers. It is not a random movement. It is refusal. Man, dirty forces out. Kelly's eyes widen. She looks at Maya as if searching for context. Noah glances toward the door, but he does not move. Harrington blinks once, twice, as if he is trying to bring her into focus through time as well as space. Tomp, son, he rasps around the tube. Kommen, der Thompson. The room goes very quiet. The ventilator continues its mechanical sigh, indifferent. The monitor beeps at the same calm rate. Maya's grip tightens on his hand without meaning to. General, she says. You are still waking up. Your memory may be mixing things. His fingers twitch again. He looks irritated in the way only someone accustomed to being understood can look. Bra, voop, he says. Bra, Vosurgi, Calt unit. Noah swallows visibly. Kelly glances from Harrington to Maya, then back. Kandahar, he breathes. The word is barely audible, but he drags it out of his chest as if it weighs something. Forward, bunker, rockets, 3 days. The images arrive in Maya's mind with unwelcome clarity. Canvas walls stained with dust. The metallic tang of blood mixed with diesel. The relentless percussion of outgoing and incoming fire. a young lieutenant shouting over the noise, a decision to stay while others ran. She feels the coin in her pocket without touching it. You refused, evac. Harrington pushes out syllables broken by the ventilator's cycle. Said, no one, left behind. Noah takes an involuntary step closer to the bed. Kelly has stopped charting entirely and is simply holding onto the side rail. The door opens quietly and Hale steps in. He has a file folder in his hand, which he forgets to close when he sees what is happening. He stands just inside the doorway, unnoticed for a moment. General, Maya says softly, you need to rest. There will be time to talk later. Harrington turns his eye toward Hale, then back to her. It is clear who holds his attention. Thought you were dead, he says. The words are rough, but the emotion inside them is not. Maya keeps her face composed with effort. I am not, she says. You are not either. Let us keep it that way. Hale moves closer to the bed, curiosity overriding whatever brought him there in the first place. What is he saying? Haley asks. Kelly answers quietly. He recognized Dr. Thompson, sir. Haley looks at her. From what, he asks. Harrington hears the question, or senses the incredulity in Hale's tone. Commander, Thompson, he insists. The consonants are clearer now, driven by stubbornness. Navy, Medical, Bravo, Kandahar. The title lands heavily in the small ICU room. Haley stares at Maya as if he is seeing a stranger in her coat. You were a commander, he says. Maya looks at him. There is nowhere to divert. Lieutenant Commander, she says the correction automatic. Then Commander briefly. Combat operations, Harrington adds, as if the record needs no editing. Held a bunker under fire, field surgeries around the clock. My nephew was in that bunker. You opened his chest with a kitchen knife when the instruments ran out. Noah makes a small sound that might be a nervous laugh, quickly swallowed. You saved him, Harrington says. You saved all of them. Maya remembers more detail than she wants to. The improvised instruments, the smell of burning insulation, the way her hands had kept moving after 20 hours without sleep because there was no alternative. General, she says quietly, you should not be speaking this much. You are stressing your vocal cords and your blood pressure. His hand twitches in hers again. There is gratitude and annoyance in the gesture layered together. Men like me get medals, he says. People like you keep us alive long enough to wear them. Kelly looks away, pretending to adjust a drip to give them a thin veil of privacy. Hale clears his throat. His voice has lost its usual crispness. Why is this the first time I'm hearing about your command experience? He asks Maya. Because it is not relevant to my work here, she says. It seems relevant in this moment, he replies. She could argue. She could explain that her file is not a secret, that the lines of text next to her degrees and fellowships list deployments and commendations in neutral language that does not convey the reality of sand and blood and constant noise. She does not. She keeps her hand around Harrington's and her tone even. I came here as a civilian neurosurgeon, she says. That is the job. Doctor, Kelly says quietly. His pressure is climbing. Maya checks the monitor. The numbers have edged upward. Increase his sedation just a little, she says. Enough to take the edge off, not enough to knock him out completely. We want his brain to rest. Kelly nods and adjusts the pump. Maya leans closer to Harrington one more time. You did your part, she says. Now let the medication do its part. You can fight again later. He blinks slowly, beat heavy eyes looking at her as if trying to decide if he trusts her this time too. After a moment, his expression softens a fraction. His grip loosens as the drugs take hold. His eye drifts closed, not from damage this time, but from enforced rest. The room exhales. Noah steps back as if released from a spell. I had no idea, he says to Maya, voice low. Most people do not, she replies. Hale still stands near the foot of the bed. His eyes move from Harrington to her and back again. There is a new calculation there, something that has nothing to do with our values and journal articles. When were you going to tell us, he asks. I was not, she says. He absorbs that answer. It has no edges he can easily file down. Outside the room in the ICU corridor, the news begins to ripple. Nurses who were not on shift when the crash happened hear that the general woke and called the new neurosurgeon by a rank. A respiratory therapist hears the word commander attached to her name. Someone pulls up her personnel file more carefully. The bare list of deployments takes on color when matched with a living witness. By the end of the day, conversations in the staff lounge have shifted. Did you hear Harrington recognized her? He called her his commander. She was in Kandahar, a forward unit. I thought that Navy thing on her CV was just reserve duty. Near the vending machines, two orderlies talk while waiting for a bag of chips to fall. She is the one who did that big surgery on him, right? One says. The one they all said was impossible, the other answers. In an office on the administrative floor, the hospital director listens to a brief report from his assistant and then glances at a media alert on his screen. The words General Harrington and heroic surgeon appear in the same sentence. In the ICU, Maya sits again in the plastic chair near Harrington's bed. The light has changed. Afternoon is sliding toward evening, a golden strip edging under the blinds. Harrington sleeps his numbers holding. She reaches into her pocket and curls her hand around the coin. The metal is familiar against her palm. It carries the weight of other rooms, other tables, other nights when the decision to say yes instead of no altered the shape of more than one life. Outside, the glass footsteps pass and voices murmur. Some of those voices carry her name. Some of them carry a title she left in another country. In the quiet space between monitor beeps, the past and present sit side by side, breathing the same mechanical air. The story slips out of the ICU within hours. At first, it is only a few lines in an internal email that circulates among departments. A brief update on the high-profile patient, noting that he has shown signs of neurological improvement after emergency decompressive surgery performed by Dr. Maya Thompson. By the evening, the language has changed. In the cafeteria, someone reads aloud from a message on their phone. "Listen to this," she says. General Cole Harrington regained consciousness briefly and identified his neurosurgeon as his former field commander from a combat medical unit. "Commander," her friend repeats. They are talking about her. The friend glances toward the line where Maya stands holding a cup of coffee she is not drinking. From this distance, she looks like any other tired doctor in scrubs. Within 2 days, the local news picks it up. A small segment runs during the evening broadcast. Grainy footage of a helicopter landing on the hospital pad appears on screen. The anchor's voice provides the rest. Sources tell us that the general's life was saved by a young neurosurgeon who once served under him in a war zone. There are no pictures of Maya. Health privacy laws and hospital policy see to that. The story becomes a silhouette and a handful of adjectives. Young, brave, decorated. By the end of the week, a national military network calls the hospital's public affairs office. They ask for a statement about the surgery, about Harrington's condition, about the doctor who operated on him. The hospital releases careful phrases. No names, no specifics beyond what is already unofficially known. The Department of Defense is less vague. One afternoon, Maya is called into the office of the hospital director. The room smells of polished wood and printer ink. Certificates hang on the walls in neat frames. The director sits behind his desk, fingers steepled. Beside him is a woman in an Air Force uniform, her hair pulled back in a tight bun, her expression alert. "Dr. Thompson," the director says, "this is Colonel Rachel Moore, Public Affairs Liaison from the Pentagon." Maya nods at her. "Colonel," she says. Moore returns the nod. "Commander," she says. Maya feels a small, familiar tension at the old title. "I left active duty 3 years ago," Maya says. "Your rank remains on record," Moore replies. "And it appears you have continued to act in that capacity in more ways than one." The director shifts in his chair. "The general's condition is improving," he says. "Slowly, but enough that people have taken notice. There is interest in recognizing what you did." "That was not necessary for the 9 cases I did last month that no one filmed," Maya says. Moore smiles faintly. It is not unkind. "True," she says, "but this one involved a 4-star general who made headlines when his plane went down. Anything tied to that becomes larger than the room it happened in." The director taps a folder on his desk. "The Surgeon General's office is organizing a recognition ceremony," he says. "At the Pentagon, they are requesting your presence." "Requesting," Maya repeats. Moore's gaze is steady. "It is a formal invitation," she says. "But yes, it carries weight." "The hospital supports this," the director adds. "It reflects well on Fort Kingsley, on our staff, on our mission." Maya thinks of the ICU chair, of the nights spent listening to Harrington's numbers, of the way his eye had locked on hers when he forced out the word commander. She thinks of the gallery above the operating room and the silhouettes watching. "When?" she asks. "End of the month," Moore says. "Assuming the general remains stable enough to attend in some capacity. The Surgeon General will be there. Senior leadership, press." Maya feels the coin in her coat pocket, the familiar weight against her side. "I am more useful in the operating room than in front of cameras," she says. Moore nods. "I imagine that is true," she says. "But sometimes we need people who can do both, even just for an afternoon." Maya studies her for a long moment, then nods once. "All right," she says. "I will go." The day of the ceremony arrives under a sky that looks cleaner than it feels. Washington, D.C. is bright and hard-edged in the afternoon sun. The Pentagon rises from its ring of roads and parking lots, concrete and glass and guarded gates. In a small dressing room, off one of the corridors, Maya stands in front of a mirror, adjusting a collar she has not worn in years. The navy dress uniform feels both foreign and familiar. Dark blue fabric, silver buttons, the bars on her shoulder reflect the overhead light. Her ribbons sit in a neat row over her heart, colors muted but present. The weight of the cloth is different from the light cotton of her lab coat. It carries history in its seams. Elena had made a quiet comment before she left Fort Kingsley that morning. "That suits you," Elena had said when Maya tried it on. "In a way the white coat never fully does." Now in the mirror, Maya sees a version of herself that belongs to another life. Sand instead of tile. Rotors instead of elevators. She slips her hand into her pocket. The coin is there. She turns it once, feeling the edge press against her fingertip. Augie! A staffer knocks on the door. Commander Thompson, they are ready for you. She straightens, inhales, and steps into the hallway. The auditorium is large and angular, filled with uniforms and dark suits. Flags stand at the front. A seal gleams on the wall behind the podium. The air hums with low voices and the soft shuffle of movement. As she walks down the aisle toward the front, people turn to look. Some faces are familiar from photographs and briefings. Some are strangers who already know her name. She takes her place on the stage where a row of chairs waits. To her left sits the Surgeon General, an admiral with kind eyes behind his glasses. To her right stands an empty spot, reserved for when General Harrington arrives, if he can. The room settles, the lights dim slightly. A man from Public Affairs steps to the podium and begins the introduction, his voice polished. Today we recognize an extraordinary act of medical skill and courage, he says. When General Cole Harrington's aircraft went down, many believed that his injuries were not survivable. At Fort Kingsley Military Medical Center, a young neurosurgeon disagreed. As he speaks, images appear on the large screens mounted around the auditorium. Not of the surgery. There are no cameras in the operating room. Instead, there are photographs from another time. A tent hospital in a desert, a group of men and women in dusty uniforms, faces smeared with sweat and exhaustion. In the center of one photo, younger without the streaks of premature gray that now thread her hairline, Maya looks into the camera with a tired, determined expression. There is a blood stain on her sleeve and a smudge of soot on her cheek. The caption beneath the image reads, Forward Surgical Unit, Kandahar Province. Maya sees the photograph and feels a brief, dizzy overlap between the person on the screen and the person standing here now. The Surgeon General rises and moves to the podium. Commander Maya Thompson distinguished herself in combat operations long before she stepped into an operating room at Fort Kingsley, he says. She performed life-saving procedures under fire with limited equipment and with no guarantee that she would survive the day, much less the night. He pauses, letting the assembled absorb the words. When General Harrington arrived on her table, gravely injured, 8 senior surgeons declined to operate, judging the odds too poor. Dr. Thompson chose a different calculation. She did what she had done before in tents and bunkers. She opened a skull that others had already closed in their minds, and she fought for every heartbeat until there was one left to fight for. The words echo faintly in the hall. He turns toward her. Commander Thompson, please step forward. She moves to the center of the stage. The lights are bright, but she can still see the outlines of people in the first rows. Among them, she catches sight of a familiar face. General Harrington sits in a wheelchair, a thin blanket over his legs. He looks smaller than he did on the operating table, the way people do when they are no longer connected to machines. A cane rests against his chair. His head bears a neat white scar where bandages used to be. Their eyes meet briefly. He nods slow and deliberate. The Surgeon General lifts a small box and opens it. Inside is a medal, on a ribbon, its metal surface catching the light. He pins it to the left side of her uniform. This Medal for Distinguished Medical Valor is awarded in recognition of your actions, he says. You did not just save a general, you upheld the highest ideals of military medicine. He steps back and salutes. Maya returns the salute. The gesture feels oddly heavy, like dusting off a movement that has been resting on a shelf. Applause fills the auditorium. It is not wild, but it is sustained. People rise to their feet. The sound comes in waves, carrying something that is not just about her. When it fades, the Surgeon General speaks again. Effective today, he says. Your commission as commander in the United States Navy Medical Corps is restored with full honors. Your service record previously closed due to medical discharge will be amended to reflect continued contribution in the line of duty. The words slide into place around her, formal and exact. She feels the coin in her pocket against the new weight on her chest. One is unofficial and scarred, the other is polished and sanctioned. Both mark the same thing in different languages. After the formalities, there is a brief reception in an adjoining hall. Tables with coffee and small sandwiches, groups of people gathered in arcs. Maya finds a quiet spot near a wall, trying to keep her back to something solid. Hale appears at her elbow, holding a paper cup. I had to see for myself that this was real, he says. She glances at him. He looks out of place in this environment, his white coat replaced by a dark suit. He holds the coffee as if it weighs more than it should. You do not like leaving the hospital, she says. I like it less when my staff gets dragged to the Pentagon, and I do not know which version of them will come back, he replies. He looks at the ribbon on her chest. You were a commander, he says again, more to himself than to her, in combat. I was a doctor who happened to give orders, she says. In rooms that shook when artillery landed, he adds quietly. I read more of your file. She raises an eyebrow. You left out a few things in our first staff meeting, but, he says. Bronze Star, several commendations, a citation for refusing to evacuate under fire. It did not seem relevant to our Wednesday case conference, she says. He looks at her for a long moment. I judged you by your age and what you had not done in my world, he says. I did not take the time to find out what you had done in yours. There's no self-defense in his voice, only an acknowledgement. I was wrong, he says. The words are simple, but they land with a different weight than most apologies she has heard. She shifts her coffee cup from one hand to the other. You were cautious, she says. Caution is not a sin in a neurosurgeon. There is a difference between caution and complacency, he says. He straightens slightly as if aligning something inside himself. For what it is worth, he adds, when I watched you in that operating room, I realized I had forgotten what it looks like when someone fights as if there is nothing safe to fall back on. He offers his hand. Commander Thompson, he says, using the title deliberately. I'm glad my first impression was not my last. She takes his hand. His grip is firm, warmer than the coffee he still holds in the other. Dr. Hale, she says, we still have work to do back home. We do, he agrees. Over his shoulder, she sees General Harrington maneuvering his wheelchair in their direction, assisted by a younger officer. He arrives with the small, careful movements of someone whose balance is still a new negotiation. Commander, he says. His voice is stronger than it was in the ICU. There is a rasp there that might never go away, but it suits him. Maya inclines her head. General, she says, you look better sitting up than you did lying down. He snorts softly. I imagine I looked like hell in both positions, he says. He looks at Hale. This your boss, he asks. In the civilian chain of command, yes, Maya says. Hale gives a small nod. Dr. Richard Hale, he says, head of neurosurgery at Fort Kingsley. Harrington regards him for a second. Your department almost let me die, he says conversationally. I am glad you have her. Hale does not argue. So am I, he says. Harrington turns his attention back to Maya. You know, when I heard your name in that ICU and thought I might be hallucinating, I was almost annoyed, he says. You keep showing up when death is too close. I could say the same about you, she answers. He laughs, then winces a hand coming up to touch the side of his head. Headache, he mutters. Reminds me I'm still here. That is one way to look at it, she says. He studies her uniform. You never really left, he says. You just changed the ceiling over your head. She thinks of the operating room lights at Fort Kingsley, bright and sterile. She thinks of the canvas roofs that used to ripple with each nearby blast. Something like that, she says. The reception continues around them, voices rising and falling. Glasses clinking. Photographers drift, capturing images of uniforms and handshakes. Maya feels pulled back toward the quieter spaces already. Soon enough, she will return to Fort Kingsley, trade this tailored jacket for her white coat, this stage for hallways that smell of disinfectant and coffee. The coin in her pocket and the medal on her chest will both come with her one visible, the other not. For now, she stands between the two worlds, listening as the faint sound of distant applause blends in her memory with the steady beep of a monitor in a dim ICU room. Fort Kingsley feels different when Maya returns, though nothing on the surface has changed. The same guard checks her ID at the gate. The same parking lot stretches toward the main entrance, lines of cars gleaming under the Texas sun. The same automatic doors slide open with a soft mechanical sigh when she approaches. Inside, however, there is a shift. People look up when she walks through the lobby, not in the quick, curious way they did when she first arrived, trying to place the new face. Now there is recognition in their stares and something else. Respect sits side by side with curiosity. A volunteer at the information desk smiles at her. Welcome back, Dr. Thompson, she says. Or should I say Commander? Doctor is fine here, Maya replies. On the neurosurgery floor, the nurse's station has acquired a new decoration. Someone has taped up a copy of a news article printed from a military website. The headline speaks of a general saved and a surgeon who once led in combat. In the grainy photograph beneath Maya stands in her dress uniform medal on her chest. The resolution is just poor enough that her expression is hard to read. As she approaches, two residents quickly move aside to clear her path. Good morning, Dr. Thompson, one says a little too formally. Morning, she answers. Any changes on our post-ops? They straighten, relieved to have something concrete to talk about. The normal rhythm of updates begins. 2 aneurysm cases doing well. 1 tumor patient with mild swelling, but no major deficits. The conversation slides back into familiar grooves. Later in the operating room corridor, Maya feels someone fall into step beside her. It is Dr. Morrison, one of the older attendings, who had been among the first to dismiss her in hushed hallway conversations weeks ago. Dr. Thompson, he says, do you have a minute? She looks at the schedule on the wall. There is a small window before her next case. I have a few, she says. He nods toward an empty conference room. They step inside. The room smells faintly of dry erase markers and old coffee. The door clicks shut behind them. Morrison clears his throat. I owe you an apology, he says. She waits. Silence stretches, giving the words space. When you first came here, I made comments about your age, he says. I told people you were an experiment. I implied you were more ambition than substance. Maya meets his gaze. He does not look away. I did that because I was comfortable, he continues. I thought I understood what a good surgeon looks like, and I measured it in years on a calendar. I did not bother to consider hours under fire or decisions made when the roof might collapse. He lets out a breath. I was wrong, he says. Completely. Watching you in the Harrington case and seeing what you brought to that table reminded me why I started this job in the first place. It was never supposed to be about protecting my statistics. His hands flex at his sides, as if he is not sure what to do with them. I am sorry, he finishes simply. Maya leans back against the table arms, loosely crossed. You do not need my forgiveness to change how you practice, she says. Perhaps not, he replies, but I wanted you to hear it anyway. She nods once. Thank you, she says. He manages a small, crooked smile. If you ever decide to run one of those combat skill workshops they are whispering about, he says, I would like a seat in the front row. That catches her attention. Who is whispering? She asks. Everyone, he says. Your name is now attached to the idea that we can learn something from field medicine. People are listening. The idea has been forming quietly at the back of her mind. It comes forward now clearer. A week later, there is a new flyer on the staff bulletin board. In plain black text, it reads, Battlefield Lessons for the Everyday Emergency Instructor, Commander Maya Thompson. MD Voluntary Training Session, all surgical and emergency staff, welcome. The conference room is full the first day. Some come out of curiosity, some out of genuine interest, some because they are residents and reflexively attend anything that might end up on an evaluation. Maya stands at the front, not in uniform this time, but in her standard hospital attire. White coat, name badge, hair pulled back. The coin rests in her pocket. Behind her, the projector screen shows a photograph of a canvas tent, sandbags stacked outside its entrance. The sky is a washed-out gray. This was my operating room for a while, she says. We had intermittent power, a couple of ventilators that hated the heat, and a generator that sounded like it was always about to die. There is a low murmur. A few people shift in their seats. She clicks to the next image. Inside the tent, someone has captured a moment between chaos. A surgeon bent over a table. Light from a headlamp cuts through dust. In the background, a medic holds an IV bag, high face blurred by motion. I am not showing you this to be dramatic, she says. I am showing you this because the principles that kept people alive there are useful here in a hospital where the power rarely goes out and we have more than 3 clamps. She walks slowly along the front of the room. In a war zone, the rule book is thinner, she continues. You still honor anatomy. You still honor physiology. But you also learn to improvise, to decide faster, to accept that sometimes there is no perfect option, only the one that gets someone to the next hour. A resident raises her hand. How do you know when to break standard protocol? The young woman asks. Here, if we deviate, there are committees and reviews. Maya considers the question. You ask yourself one question first, she says. Is this decision for the patient or is it for me? If the answer is truly for the patient and you have exhausted safe, conventional paths, then sometimes stepping outside the usual sequence is the right call. But you have to be willing to own it afterward. The room is quiet for a few seconds. In the back, Hale leans against the wall, arms crossed. He has not announced his presence, but he is there. His expression is thoughtful rather than guarded. Maya moves through scenarios, some from the field and some from civilian practice. A soldier with multiple amputations and no blood bank. A car crash victim with a crushing head injury who arrives during a storm that has knocked out half the hospital's systems. Each example carries a question about prioritization, creative thinking, and the balance between caution and action. Near the end of the session, someone in the doorway draws a few glances. General Harrington stands there, in a uniform tailored to accommodate his still healing frame. He has a cane, but he walks with it as if it is a suggestion rather than a requirement. The conversation at the front pauses. Please do not stop on my account, he says. I came to listen, and maybe to say something. Maya inclines her head. You are welcome to join, she says. He makes his way to the front, turning to face the room. I have spent most of my career giving orders, he says. His voice fills the space easily. People salute, they say yes, they carry out missions in far places. You start to believe leadership is about being the one with the final word. He looks at Maya. Then you find yourself on a table with your skull open and your life depends on someone who does not care about your stars, he says. She did not ask what my rank was. She looked at my scan and decided she was going to fight for me when others were ready to sign paperwork. Several faces in the room flush. Harrington lets them sit with that, then continues. In my world, you are taught that retreat can be strategic, he says. That sometimes pulling back is the smart move. In medicine, you do not always have that luxury. Retreat can mean letting someone slip away because you protected your record more than their chance. He looks at the residents, the nurses, the attendings. Some of you will never see a battlefield, he says. That is a good thing. But you all walk into rooms where the stakes are just as real. The enemy is time or bleeding or cells that do not know when to stop dividing. You need people like her to remind you that leadership in here looks like standing next to a bed when everyone else has stepped back. He nods toward Maya, then settles into a chair near the side his speech done. The room is very quiet for a heartbeat. Then someone starts to clap. It builds not the formal applause of the Pentagon auditorium, but something more raw and close. Maya feels her face warm. She lifts a hand palm out. All right, she says. Enough. We have work to do. The laughter that follows breaks the tension. After the session, as people filter out, she stands at the door. A few stop to thank her. Some apologize in roundabout ways for earlier skepticism. Others simply nod the way soldiers do when words feel unnecessary. Hale approaches last, his hands in his pockets. These sessions, he says, we should make them regular, not just a one-time event. People will get tired of my stories, she says. Then bring in others, he replies. We have more veterans on staff than we think. Let this be a space where that experience is not something they avoid mentioning. She studies him for a moment. That is a different tone from the one you had when I first arrived, she says. I have been attending my own quiet seminar, he answers. You have been an effective instructor. There is a hint of amusement in his voice now. They step into the corridor together. The hospital feels subtly rearranged. Protocols have not changed on paper, but the people applying them carry new questions behind their eyes. On rounds, discussions include not only what is permitted, but what might be possible. Residents seem a little less afraid to voice unconventional ideas. Nurses speak up more often when they see early warning signs. In the ICU, the bed where Harrington once lay full of tubes is occupied by another patient, now a young woman after a serious car accident. Maya pauses at the doorway during rounds. The monitor beeps steadily. The ventilator whispers. The patterns are both familiar and always new. She moves on to the next room. Outside, the sun slants across the parking lot. A helicopter lifts off from the pad, its rotors beating against the sky. Inside, fluorescent lights hum over hallways that smell of antiseptic and coffee. Maya walks those halls with the same stride she had on her first day, but the echo it leaves behind is different now. The announcement comes on a Tuesday morning, tucked into the middle of an otherwise ordinary day. Maya is midway through dictating a post-operative note when a message arrives from the hospital director. The subject line is formal, request for meeting. She finishes her sentence, signs the note, and heads upstairs. The director's office looks the same as before. Same framed degrees, same carefully arranged model of the hospital on a side table. This time there are two visitors waiting. Colonel Rachel Moore sits in one of the chairs, uniform crisp. Beside her is a man in a dark suit with a Department of Defense badge clipped to his pocket. The director rises. Dr. Thompson, thank you for coming. Maya nods. Of course. Moore gestures to the empty chair. Have a seat, Commander. Maya sits. The man with the badge offers a small professional smile. I am Daniel Hayes, he says. Office of Military Medical Partnerships. She waits. We are launching a program, he continues. The Global Field Medic Initiative. It will bring together allied nations to standardize and improve combat trauma care, not just in active war zones, but in disaster responses and humanitarian crises. He glances at Moore, then at the director. We would like you to serve as a special consultant, he says. You would continue your work here at Fort Kingsley, but you would also help develop training advice on protocols and mentor teams that will be deployed around the world. The words settle in the room. Moore leans forward and says, You have already been doing this in a way, she says, taking the lessons from the field and translating them for civilian practice. This would widen the circle. Maya thinks of the conference room sessions, of the tent pictures on the screen, of the questions from residents whose feet have never touched desert sand. She thinks of Harrington standing at the back of the room, cane in hand, talking about leadership and retreat. What would it change here, she asks. My schedule, my patience. There would be travel, Hayes says. Training conferences, planning meetings. We would coordinate so your duties at Fort Kingsley are covered when necessary. You will not be pulled away without warning. The director adds, We support this. It puts our institution at the center of something important. Important, she thinks, is a vague word. She hears other things underneath it. Useful, visible. She also hears something else from a different time. A young medic in a tent, asking her how to decide which patient to take first when there are too many. She slips her hand into her pocket and curls her fingers around the coin. What exactly would you need from me? She asks. Hayes smiles. The part of you that said yes when everyone else said no, he says. and the part that knows how to teach others when that yes is the right one. She looks at Moore. The colonel's eyes are steady. You can say no, Moore says. You have given plenty already. Maya lets the silence stretch. The hum of the air conditioning fills it. From somewhere below, faint through the walls, comes the distant rhythm of a monitor in one of the units. Beep, beep, beep. She nods once. All right, she says. I will do it. The formalities move quickly after that. A week later, there's a small ceremony in the main auditorium at Fort Kingsley. Nothing like the Pentagon's polished spectacle. This is local quieter. Doctors in white coats and scrubs fill the seats. Nurses, techs, administrators, and a few uniformed officers from the baseline the walls. The stage is simple. A podium, a flag, a projection screen that remains blank. The director speaks first, then Hayes. They talk about global partnerships, shared knowledge, the idea that what is learned in one place can save lives in another. Maya stands to the side, hands clasped dress blues exchanged for her usual white coat. She feels more herself in this cloth. The coin sits in its familiar place. When it is her turn at the podium, she does not bring notes. I have worked in a lot of rooms, she says. Tents with dirt floors, trailers that smelled like diesel, operating theaters like the ones just down the hall. She looks out at the faces before her. Some she knows well. Some she has only passed in corridors. In all of them, the problems were the same, she continues. Bodies broke in predictable and unpredictable ways. Time was either our ally or our enemy, sometimes both. People were afraid, and we had to decide what to do anyway. She lets the words hang for a moment. This new role will not change the fact that I'm your colleague, she says. I will still be here in the mornings arguing about case plans and asking residents why they left out a detail in a note. But it does mean that the lessons we learn in this building will not stay inside it. They will travel farther than we do. She steps back. The applause is warm, not grand. It feels like a blanket rather than a spotlight. After the ceremony, the crowd drifts into the main corridor. The hospital has arranged a small reception with coffee and cookies on folding tables. Conversations knot and loosen. On the way back to the neurosurgery floor, Elena walks beside her. Global consultant, Elena says. That has a nice sound. It sounds busy, Maya replies. You were never very good at being idle, Elena says. They stop at a new installation on the wall near the elevator bank. It is a glass case with brass plaques lined in rows. Above it, letters spell out Doctors of Valor. Each plaque bears a name, a rank, a brief description. Elena nods toward the middle row. You have a spot now, she says. Maya steps closer. Her own name is engraved in clean lines. Commander Maya Thompson, combat surgeon and neurosurgeon. Forward Surgical Unit, Kandahar Province, Fort Kingsley, Military Medical Center. Below that, one more line. Fought for one life at a time. Her throat tightens unexpectedly. The words are simple, but they mirror something she has thought in private, never out loud. She reaches out and rests her fingertips lightly against the glass. The surface is cool, smooth, unyielding. Her reflection looks back at her, faint among the letters. You belong up there, Elena says. So do a lot of people whose names will never be on a wall, Maya answers. Elena does not argue. She stands with her for a moment, both of them looking at the rows of names, then peels away when a pager chirps at her hip. Maya stays a little longer, then turns to go. In the residence lounge, an hour later, there is a knock on the doorframe. A young woman stands there, white coat, slightly too big, stethoscope looped awkwardly around her neck. Her ID badge reads Dr. Lauren Kim. Her eyes are earnest and a bit anxious. Dr. Thompson, she says. Yes, Maya answers. I am starting my neurosurgery residency here next week, Lauren says. I got permission to come early, see the place, meet people. Smart, Maya says. Saves you from getting lost that first morning. Lauren smiles briefly, then loses the expression. I wanted to ask you something, she says. If that is all right. Go ahead, Maya says. Lauren shifts her weight. I am 26, Wal, she says. I look younger. I have already had people assume I am a student. I am worried that when I walk into a room, no one will take me seriously, that they will see my face first and not what I know. Maya watches her fingers twist the edge of her coat. I heard about you, Lauren continues. What you did for General Harrington, what you did before, you walked into rooms like that. I was wondering how you handled it. The question lands close. Maya considers her for a moment, the nervous energy, the quiet determination under it. She reaches into her pocket and brings out the coin. It sits on her palm, worn silver edges, nicked emblem faded. The small length of burned chain clinks softly when it moves. She extends her hand. Hold this, she says. Lauren hesitates, then takes it. The metal is heavier than it looks. It is from a unit I served with, Maya says. It has been in more rooms than I can count. When I was your age, I kept it with me every time I thought someone might not let me forget how young I was. Lauren turns the coin between her fingers, tracing the blurred design. Why are you giving it to me? She asks. Because you asked the question out loud, Maya says. That tells me something about the kind of doctor you want to be. Lauren looks down at the coin, then back up. What do I do with it? She asks. Keep it, Maya says. Put it in your pocket. When someone looks at you and only sees your age, remember that they are making their own job harder, not yours. Lauren nods slowly. And let them... Maya adds, do not let them measure you by the year you were born. Make sure they measure you by what you do when someone on a bed needs you. That is the only number that counts. Lauren closes her hand around the coin. Her grip is firm. I will try, she says. Do more than try, Maya replies. Our patients do not have time for us to ease into courage. A pager goes off in the hall. Somewhere an overhead voice calls for a rapid response team. The world pulls at both of them. Thank you, Lauren says. She steps back, cradling the coin in her palm, as if it is something fragile and solid at the same time. Later that evening, Maya steps outside into the hospital courtyard. The air is cooler, the heat of the day easing into a softer warmth. The sky over Texas is streaked with orange and purple, the sun sinking behind the low skyline. The flag over the main entrance flutters in a light breeze, its fabric catching the last light. General Harrington stands near one of the benches, cane resting beside him. He is out of uniform today, in a simple shirt and slacks. He looks like any other older man recovering from a major surgery except for the way he carries himself. You walk farther every time I see you, Maya says. Physical therapy is determined to earn their funding, he answers. They stand side by side watching the flag move. Hayes told me about your new appointment, Harrington says. Global Field Medic Initiative. He is efficient, she says. He is excited, Harrington replies. You will be good at it. The courtyard is quiet. Through the glass of the lobby, figures move like shadows in a lit aquarium. The military needs more commanders like you, Harrington says after a while. People who know the cost of decisions and still make them. Maya looks at the windows at the reflected sky. The world needs more people who will fight for one heartbeat at a time, she says. Rank does not have much to do with that. A transport van pulls up near the entrance. An orderly wheels a patient toward the doors, blanket tucked around thin shoulders. Inside the building, a monitor beeps faint through the glass. The sun slips lower, casting long shadows across the courtyard. The flag glows for a moment, red and white and blue edged with gold. Maya takes a breath and feels the air fill her lungs. Somewhere inside, a pager will go off again. A new scan will appear. Another decision will wait. She turns back toward the hospital doors. Walk with me, General, she asks. He lifts his cane. Always, he says. They move toward the entrance, together footsteps in rhythm, heading back into the bright, busy light. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts. So feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.